Let's be honest. Trying to navigate all your healthcare benefits, especially when you're dealing with Medicare, can feel like you're trying to solve a giant puzzle. And that's exactly why experts like Mills and Associates are so incredibly helpful. They really cut through all that noise to find the plans that are perfect for your specific needs. One of the biggest questions they help people with is how to cover all those things that your main plan might miss. So today, we're going to dive into one of their go-to solutions, these all-in-one supplemental plans for dental, vision, and hearing.
So just for a second, think about your current health plan. Yeah, your regular doctor visits are probably covered, but what about everything else? I'm talking about your teeth, your eyes, your ears. Do you have gaps in your coverage there? Because these are absolutely essential parts of our overall health, and they often get overlooked by standard insurance.
So what's the answer? Well, a lot of the time, it's an all-in-one supplemental plan that bundles these three key benefits into one simple package. And to really see how these work, we're going to use the DentalWise Max integrated plan to walk through it all in this explainer.
So why even bundle them together? Well, the logic is actually pretty simple. You get one convenient plan for your mouth, your eyes, and your ears. No more juggling different policies. They're built to be budget-friendly, and here's a huge plus. For most services, there are no waiting periods. You can start using your benefits right away. At the end of the day, it's all about protecting your health and your budget, which, let's face it, is a pretty powerful way to improve your quality of life.
Okay, let's get into the nitty-gritty, and we'll start with the biggest piece of the puzzle, your dental coverage. Now, it's got a few different layers, but don't worry, we're going to break down this three-tiered system so it's all crystal clear.
The very first choice you get to make is your annual maximum benefit. That's just the total amount the plan will pay out for your dental care in one policy year. The options are really straightforward. You can pick a $1,000, $2,000, or $3,000 maximum. This flexibility lets you pick the plan that really fits your budget and what you think you'll need for the year.
Now, here's where it gets really interesting. This plan actually rewards you for sticking with it. As you can see, Preventive Care, we're talking cleanings and checkups, is always covered at 100%. But just look at that jump in coverage for basic and major services after your first year. Coverage for something like a filling goes from 60 to 80%. And for the big stuff like crowns, it leaps from just 15% all the way up to 50%. When you think about how a single crown can easily cost over $1,000, yeah, that is a massive difference. We're talking real savings here.
Okay, so before that coverage for basic and major stuff kicks in, there is a deductible. It's a simple, flat $100 fee that you pay out of pocket just once per policy year. Once you've paid that, the insurance starts picking up its share of the tab. And remember those preventative services that are covered at 100%? No deductible for those at all.
All right, let's zoom in on a really important major service, dental implants. Now, because this is a pretty big deal, it's got its own special set of rules. First off, this benefit is only available in those higher-tier plans, the $2,000 and $3,000 options.
For those plans, there's a separate lifetime maximum benefit just for implants, and that amount is $1,500. The best way to think about it is like a dedicated fund, totally separate from your regular annual maximum that's set aside just for implant procedures.
And this next part is super important to remember. Unlike most of the other services, for implants, there is a 12-month waiting period before that benefit becomes active. So you really have to plan ahead for that one. It's a key detail to keep in mind.
All right, that's the dental side of things. Now let's see how this plan takes care of your vision and your hearing. And the best part? Unlike that implant benefit, there are no waiting periods for any of these perks. You can literally start using them on day one.
Just look at the difference here when it comes to staying in-network. If you use an in-network provider, your eye exam costs you absolutely nothing, zero. But if you go out of network, you get a $50 allowance instead. It's the same story for frames. You get double the allowance, a full $150 just by staying in network. And for standard lenses, it's just a simple flat $10 copay. Super easy.
So what exactly is an allowance? Well, the easiest way to think of it is like a gift card from your insurance company. Let's use the frames example. The plan gives you a $150 allowance for in-network frames. If you pick out a pair that costs $200, the plan pays its max, the $150, and you just cover the extra $50. It's just the maximum amount the plan will chip in for that item each year.
The hearing benefits are just as straightforward. Your annual exam is 100% covered. You also get a pretty generous $750 allowance for hearing aids every 2 years, which even works for over-the-counter aids. But listen very closely to this next part, because this is the one thing you have to remember. To get any of these benefits, you absolutely must use a provider in the UnitedHealthcare Hearing Network. That is a deal breaker for coverage.
You know, understanding a plan isn't just about what it covers. It's also about being really clear on what it doesn't cover. Knowing the exclusions up front is going to save you a ton of headaches down the road. So let's quickly run through the main ones.
So, on the dental side, the plan isn't going to cover services that are purely cosmetic. Think teeth whitening. It also doesn't cover treatment for TMJ, those specialty night guards for grinding your teeth, replacing a lost or stolen denture, or getting your wisdom teeth surgically removed.
And for vision and hearing, it's a pretty similar story. Things like non-prescription sunglasses or elective surgeries like LASIK aren't covered. And for hearing, like we just stressed, anything from a provider who's not in the network is automatically excluded, along with things like batteries or replacing a lost hearing aid.
Okay, so we've covered the nuts and bolts. Now let's talk strategy. How do you really squeeze every last drop of value out of a plan like this and make it work for you? It really just boils down to these three simple things. First, please use your preventive care. Your exams and cleanings are covered at 100%. It's the easiest way to stay healthy and save money. It's basically free money for your health. Second, always stay in network. Like we saw with vision and hearing, that's where the huge savings are, and sometimes it's the only way to get coverage at all. And third, just remember that this is a supplemental plan. It's designed to fill in the gaps and work together with your primary health insurance, not to replace it.
And you know, this quote here really just sums up the whole reason a plan like this is so important. Your overall well-being is about so much more than your annual physical. It's your ability to eat comfortably, to see the world clearly, to hear your grandkids laugh, and to connect with the people around you. That's what this kind of coverage is really designed to protect.
So we've gone through a lot of detail here. And the big question is, what's the right move for you? How do you find the exact plan that fits your life, your health needs, and your budget?
Honestly, the best thing you can do is talk to an expert, someone who lives and breathes this stuff every single day. The official guide for this plan actually directs you to a specialist who can answer all your personal questions and guide you to the right choice.
And that expert is Dan Mills at Mills & Associates for personalized advice on this specific plan. Or for help with any of your other Medicare and healthcare insurance needs, this is who you want to talk to. Their team has the expertise to make absolutely sure you are fully and properly covered. Thanks so much for watching.